A generation ago, an AIDS diagnosis meant sure and agonizing death. It was 23 years ago when I was in the House of Representatives and I was walking to the chamber for a vote when I saw a colleague and friend, Tom McMillan, congressman from Maryland, coming my way. You wouldn't miss Tom McMillan. He played in the NBA. He was tall. And as he passed on the sidewalk, he stopped and he said, "Magic has AIDS." It was a stunning announcement that Magic Johnson had been diagnosed with AIDS. The reality is that's 23 years ago. At the time, we felt that this was a death verdict. There was no way to escape it. Last month, American researchers revealed that a second American baby born with HIV has apparently been cured of the virus with drugs delivered just minutes after birth. How far we've come in 23 years from an AIDS diagnosis, meaning certain death, to being able to cure, for the second time, a baby born with HIV with drugs delivered minutes after birth. These babies were treated as part of a research program at the National Institutes of Health. Their apparent cures offer real hope for 250,000 babies who were born into the world this year with HIV, many of them in desperately poor nations. And it isn't the only thing that's happening when it comes to medical research by a long shot. In my home state of Illinois, Dr. Jose Oberholzer from the University of Illinois at Chicago and Dr. Xuanrong Luo from Northwestern University are among scores of researchers throughout the country on an NIH-sponsored project to find a cure for type 1 diabetes. Do you know anyone with type 1 diabetes? I do. To think that we are close enough to even consider the possibility of a cure just should spur us all on to want more research in this area done as quickly as possible. These two doctors are part of an effort called the Clinical Islet Transplantation Consortium. Islets, a group of beta cells in the pancreas that produce insulin. Type 1 diabetes destroy these cells. Transplanting healthy beta cells into the liver of someone with type 1 diabetes can enable the person's body to start producing insulin on their own, a functional cure for type 1 diabetes. This isn't just a theory, it's starting to show results when it comes to this clinical research. Why do I raise these amazing medical research stories on the floor of the Senate? Because the United States Senate and the House of Representatives each year vote on how much money we're going to put into the National Institutes of Health. And we've had some sad outcomes in recent years. Did you know that over the last 10 years we've been unwilling to give the National Institutes of Health even a cost of living adjustment? So each year they've fallen behind in medical research just because of inflation. They've fallen behind 22% in awarding research grants like the ones I've just described because we have failed to provide a cost of living adjustment for them. Does anyone believe we're saving money by cutting back on medical research? If they do, they're just plain wrong. They had a program announced about a month ago at NIH. It's called AMP program. It's a new undertaking. The 10 largest pharmaceutical companies have put up $150 million, not a great amount of money for successful pharmaceutical companies, but an investment to be matched by NIH, and they're setting out to use human genomic mapping and cell information to find cures for Alzheimer's, type 1 diabetes, and rheumatoid arthritis. Can we afford this? Can we afford this research? Do you know what we paid last year in Medicare and Medicaid just for Alzheimer's patients? $203 billion, 1 year. If we can, through our research, find a way to at least delay, if not cure Alzheimer's, think of the misery that will be spared these poor families that suffer from Alzheimer's, and think of the money we will save. Are we so short-sighted as a nation that we have forgotten that medical research not only finds cures, but saves us money that would otherwise be spent for medical care? That's why I introduced 2 weeks ago the American Cures Fund. It's different. There aren't a lot of proposals like it before Congress. What I'm doing with this proposal is trying to get Congress on both sides of the aisle, in both chambers, to make a commitment to American medical research, American cures. And here's the commitment. Over the next 10 years, I want a commitment that we will increase the funding in medical research beyond inflation 5% a year. 5%. For the National Institutes of Health, for the Centers for Disease Control, Department of Defense, medical research, and the Veterans Administration, medical research. What's the cost of that? The cost of that is $150 billion over 10 years to make a commitment to go forward on medical research. It's a lot of money. It's a lot of money until you consider what the cost is each year of Alzheimer's, $200 billion. Not to mention the cost of diabetes, arthritis, and so many other illnesses and diseases that call for huge investments when it comes to medical care. Where in the world can we get $150 billion over 10 years? Where could we possibly find it? Let me give you a starting place. Increase the federal tax on tobacco products by 95 cents. I'm for that. I'll tell you why I'm for it. I've been fighting tobacco as long as I've been in Congress, House and Senate, and what I have discovered is if you want to discourage young people from smoking, taking up tobacco addictions that will ultimately cost them their lives, raise the price of the product. They stop buying them. In my lifetime, we've seen the percentage of Americans smoking cut in half. So raising that tobacco tax gives us money for medical research and reduces the likelihood that people will become addicted to nicotine and tobacco. 700,000 Americans will not take up the tobacco habit if we raise that tax 95 cents. It's money well spent on medical research. If we don't do this, what happens? We fail to find the cures for diseases. We continue to make massive expenditures in Medicare and Medicaid and other health programs, and we watch the world pass us by. If the United States decides to retreat when it comes to biomedical research, other countries are ready to step in. Now, today, China is investing 12 to 20% more each year in government research and medical research each year. In 8 years, China will surpass the United States in dollars spent on government and medical research. Are we ready to let that happen? I hope not. For the sake of the people who live in this country, who need cures for these diseases and help, for the sake of the cost to our healthcare system that all of this medical challenge presents, and if we want to maintain a lead when it comes to researchers and doctors and hospitals, it's time for us on a bipartisan basis to make a commitment to medical research. I hope that others will join in co-sponsoring this American Cures Fund. A number have done this already, and I thank them for joining me. One of them is on the floor, my colleague from California, Senator Boxer. She's always by my side. We've fought a lot of these battles together. And the list goes on. Senators Reid of Rhode Island, Brown, Hirono, Feinstein, Gillibrand, Cardin, Hagan, Casey, Markey, and Mikulski, and we're just getting started. I might also say that Congresswoman Dana Eshoo is co-sponsoring this measure in the House. Can't think of a more important thing that we can do to make this a better, safer nation, to reward research, to find cures for diseases, and to make sure that our country continues to lead the world when it comes to biomedical research. I hope my colleagues will join me and co-sponsor this legislation. I yield the floor.